Hello, everyone. My name is Jeff Donnell, and I am president of Enterprise Health, and I'd like to welcome you to A Dose of Reality, today's webinar on managing an employee flu program in a COVID-19 environment. I want to thank all of you for registering and attending, and this is actually the fourth webinar that we've conducted since the COVID-19 pandemic began. And the interest in these has been outstanding, so we really appreciate your attendance. Just a few housekeeping items. We've muted everyone except our panelists on entry so that we can minimize background noise. I also want to let everyone know that we are recording the session today, so we'll email everybody early next week with a link so that you can access the recording and share it with others who maybe were not able to attend today. As always, we like to point out that given the uptick in the use of virtual conferencing, sometimes we experience a glitch or two with WebEx, so hopefully that will not happen today. Keep our fingers crossed. And we're very fortunate today because we've assembled a really tremendous panel of experts who know more than a thing or two about managing a mass immunization program. And we've asked each of our panelists to talk a little bit about what they're working on as they prepare for this year's flu season, and then we'll open it up for a Q&A session. So you can submit questions via the chat feature in WebEx at any time, and then we'll get to as many of your questions as we possibly can at the end. I also want to point out that we are scheduling another webinar about 3 weeks on Wednesday, June 24th. And at that webinar, we're going to address the fact that COVID-19, kind of ironically, just really dramatically underscores the critical importance of having strong occupational and employee health programming and the IT infrastructure to support it. So in some respects, there's really never been a better time to make the business case for increased investments in employee health, but that business case has to be made during a period of economic uncertainty. So during this webinar, panelists will talk about the growth outlook for occupational health and provide some practical advice on how to make a case for expansion. More information will be coming your way on that one very soon. So before we turn it over to our panelists, I'm just going to quickly provide a little context on our organization and today's topic. Now, if we were stuck on an elevator together and you asked me who Enterprise Health is, I would say that we're the only cloud-based health IT solution that combines occupational health and compliance, clinical care, and employee engagement all on a single, interoperable, certified electronic health record platform. And our focus is on equipping enterprise clients and their employees for a healthier future. We actually work with a number of blue chip organizations, and that includes global corporations, government agencies, and hospitals and health systems who operate their own on-site employee health clinics, and many of them also provide employee health services to other organizations. And the logos you see on the screen are just a few of our clients. And since February, we've been working very, very closely with our entire client community as part of a widespread collaborative effort to rapidly respond to the things that are going on with COVID-19. And what we've done is really modified our existing pandemic response, medical surveillance, case management, encounter documentation, employee engagement, and reporting capabilities to help our clients with their specific use cases. And that spans travel, employee monitoring, testing, case management, those sorts of things. And we've all been working together at a rapid pace. We're making refinements on a very regular basis because this is a very dynamic situation. Things change on a regular basis. We've also packaged up that COVID-19 functionality, and we launched a standalone COVID-19 monitoring application that people are starting to adopt and use. We also developed and rolled out new telehealth capability. That was something that was already on our development roadmap, but we were able to accelerate that and get it launched within a matter of days. And last week, we actually started rolling out contact tracing capability. And our plan is to continue to really maintain an agile footing, and we're compressing our normal development cycles from months to weeks down to days. And not long ago, a number of our clients started to come up for air, at least a little bit, from the COVID crisis. And several of them noted that, flu season is just around the corner. So while it's early June, people are looking ahead to the fall. And several of these clients recognize that the mass immunization of employees in the fall of 2020 is certainly going to be complicated by COVID-19. I think we've all seen in the news that the topic of vaccinations is getting more attention, and the popular press is already starting to urge people to get flu shots this year. And the CDC is certainly noting that health systems who might see another wave of COVID patients in the fall really don't want to have to deal with a simultaneous wave of people who are suffering from the flu. And we've worked with a number of our clients over the years to really streamline the mass immunization of employee populations, but many of the strategies and the technology solutions that we've put in place, ironically, don't necessarily line up all that well with social distancing concepts. So once again, we're collaborating with our clients to make adjustments for a new reality. So today, you're going to hear from Samantha Lodish, who's a client at Wake Forest Baptist Health, and she's going to talk about what they're doing at their health system where flu shots are mandatory. And by contrast, you'll hear from Tiffany Bould at CITGO, and she works in a corporate setting where flu shots are completely voluntary. And then Emily McComb from Enterprise Health is going to address some of the things that we're working on to refine our application based on input from Samantha, from Tiffany, and from several other clients that we work with. So our first panelist today is Samantha Lodish. Samantha manages the administration and tracking of about 33,000 flu vaccinations each year at Wake Forest Baptist Health. Samantha is very passionate about this topic, as you'll soon see, and her group does some really, really creative things to make this effort successful. So Samantha, let me real quick pass control over to you.
Okay. So thank you for the introduction. My name is Samantha Lodish. I am the Administrative Manager for Wake Forest Baptist Health for the Employee Health Department. And I'm just going to start out by giving you a little background on our organization for anyone who's not familiar with the hospital. We are an integrated clinical and academic healthcare system in Winston-Salem, North Carolina. So we have about 885 beds in our Winston campus alone. We have 5 community hospitals, and we have about 300 primary and specialty care locations. All in all, we have about 20,000 employees. In addition to that, we have 10,000 contract and student workers. So the Employee Health Department is open 5 days a week. We have 5 clinic locations. We have 17 total staff members that work across all of them. We kind of float our staff around. We do acute and work-related visits, and we also do matriculation. We kind of bring on the med students for the School of Medicine. So I know we're here to talk about the flu campaign specifically. It's something that we've been working really hard on for probably the last 15 years. It is our only truly mandatory component for the medical center. It's mandatory for every employee, contract worker, or student who sets foot onto the medical campus. We hold it from October 1st through October 31st, and it is completely managed by our department in employee health. To become compliant, employees have 4 options. They can receive their vaccine at an employee health clinic location. They can submit a request for a medical exemption. They can submit proof of a vaccine from an outside source, or they can receive it from an in-network provider, so a primary care physician who also works for the medical center, and that will automatically feed into our enterprise health system. For the 2019-2020 flu vaccine season, we administered just over 10,000 vaccines. Oh, I'm sorry. We administered just over 17,000 vaccines. We had about 5,000 that were completed outside of our network, and we interfaced over 2,000 that came from our other family practices. So we're able to keep our employees, they come in, they get their vaccines. Like I said, it's mandatory. This is because we do have consequences if they don't follow it. By November's deadline from this year, we had an overall compliance rate of 99.3%. Employees who don't comply with us during the designated time frame will be locked out of all electronic systems that they need for their jobs. So they won't be able to check their email, they won't be able to sign into our PeopleSoft timekeeping or clock in, and they won't be able to sign into Epic to see any patient care. So we manage the flu program, and most people think of the flu as just kind of over the winter time, but we actually start our planning in June. So we actually have our first meeting today, and we run it through late April, usually early May is when we do our final reporting. So it's an almost year-round planning and managing that we do for it. there is a flu committee, which consists of approximately 55 people from different areas of the organization who meet with us. And we meet about weekly. Once we hit August, sometimes we'll meet twice a week if we need to. We use an electronic record keeping to maintain all of our data. We used to be on a different EMR that we kind of had to use two different ways to manage our flu campaign. We were using it through PeopleSoft to document our flu vaccines, and then we were having to manually print it out and do different types of reporting, had it all be done manually. So we were doing it on spreadsheets, we were doing it on paper. As you can assume, with 20,000 employees trying to keep track of a mandatory campaign, it was very difficult. It didn't come without, and I'm just kind of skimming through these slides while I paraphrase, so bear with me. It didn't come without a lot of people error. We had a lot of people who were losing access who maybe shouldn't have, because we were just trying to keep track of everyone and we didn't have an efficient way of doing it. So that's one thing that Enterprise Health has really helped us with, because now that we are using Enterprise Health, we're able to keep all of that data in one area, and then likewise we're able to manage it and report on it from there. So bear with me while I go through some of these so I can talk about how we are running the actual program now. Okay. So for the immunization, we use the employee portal. It's one of the biggest improvements to our flu campaign in the last 2 years. So employees will sign on to their portal. They can complete their authorization to become vaccinated from the portal directly. They can also submit their proof of vaccine if they got it done someplace else right to their portal, and they can also request a medical or religious exemption through the portal as well. They automatically get notifications and reminders about the requirement, as well as the open clinic times in any locations. If an employee doesn't complete the form prior to arriving at an employee health clinic, like if they don't have their authorization done, we use iPads so that they can do it while they're in the waiting area. We have also started using QR codes. We place them in employee areas such as elevators or in break rooms so that employees can scan it with their smartphone. It takes them right into their portal, and then they're able to fill out their consent easily from there. During the open clinics, our nurses administer the vaccine. We actually run it a little bit differently. We have 2 people who sit at the front of our clinics, and they actually handle all the documentation. So somebody will come in, we'll ask them if they've already completed their authorization, and then we simply document it using iPads that we have sitting there. And then we send them over to a vaccinator to be vaccinated. If they haven't filled out their consent, then we also do their consent for them right there. It's really good to mention that, especially with COVID this year, this all requires no signing of paperwork, no handing over objects. You know, it's stuff that we have documenters who are just documenting. They hold the iPads, they ask the employee the questions if they need to, they initial on behalf of the employee if they need to, and then they send them over to the vaccinator. So the vaccinator is not having to touch the iPads, talk to the patient, have the patient touch the iPad. We kind of have it very separate so that there is no handing off or mixture of those items. This is something that we have been doing the last 2 years, so it just so happens that it helps us for this year going into a time when certainly everyone's going to be a little bit more concerned. When the nurse begins entering the patient's name or scanning their ID badges, which we haven't done but is a possibility, the system automatically pulls the data forward from their electronic questionnaire, so it tells us if they have any allergies or any reason why we shouldn't be able to give them their vaccine, and then we're ready to vaccinate them. A key benefit to documenting and managing the flu vaccine within this record system is that we are able to own the entire process from start to finish. We own it from the point where they fill out their authorization, through vaccinating them, through the end where we know that our compliance rate, and then at the very end when we need to pull any reporting for the NHSN reports that we do at the end of the year. It's been a huge benefit to us. Another thing that I always like to mention is that we use the manager portal as well. It allows our managers to be able to go onto the portal, check the compliance rate themselves, see if their staff have been vaccinated. This makes it so that when we turn their access off, if they haven't been, there is no surprise at the very end of the season when their staff can't log in. I think that pretty much covers how we handle our entire process. And I know I speak very fast, so I'll apologize to anyone. And I, of course, will be here and open for any questions at the very end.
Samantha, that was great. We appreciate that. And our next panelist is Tiffany Bould. And Tiffany is the Health Services Manager and Nurse Practitioner at CITGO. And Tiffany is a self-described employee health nerd and oversees a voluntary flu program at CITGO. So with that, we'll turn it over to you, Tiffany.
Hi, thanks. So a little bit about our company. We have about 3,000 employees in 4 main locations. The headquarters location is where I'm at. It's myself and 2 registered nurses. Our largest refinery is in Lake Charles, Louisiana, and that's staffed by a nurse practitioner and 3 registered nurses. We have 2 smaller locations, one in Illinois and the other in Texas. Those both have about maybe between 350, 500 employees at each, and they're staffed with a nurse practitioner and a registered nurse. We have, at the headquarters location, we also have an additional responsibility for terminals and pipeline locations, and that's about 400 employees, and they're spread out from Florida all the way up to Maine, and each one of those terminals have, some may have 1 to 2 employees, and others may have 10 to 12. So those are fairly, usually our biggest challenge in managing those locations. We also have about 200 employees in 3 lubricants plants, one in Illinois, one in Oklahoma, and the other in Georgia. So we are spread out pretty well between those 2 groups. Our employees have the option to receive the flu immunization in 2 different ways. They can either do it through our benefits and can go to the local or community resources, and that's provided to them 100% no charge for them. We don't get any records if they go out to the community to receive them. If they choose to, we do provide it on site, and at the lubricant facilities, we contract for people to go on site there since they're spread out. Next slide, please. So out of the 3,600 employees, we usually give about 1,100 flu shots on site. So that doesn't count the community, the employees that go out in the community. Our employees typically use the on-site resources just because it saves them time. It's very convenient for them because here at the headquarters office, they may just have to walk down the hallway to a conference room or so. And it's also, we have a lot of coworker pressure. They'll grab each other from the offices, you know, and joke with each other. If I'm going to get it, you're going to get it, or if you don't get it, give me the flu. So they have a lot of that going on. So that actually is more of a challenge between them, and they have fun with it. I've already started getting phone calls here at headquarters from people who saying, look, make sure you have enough flu shots this year because I've never gotten it and I'm getting it this year. So we've gone on ahead and we've bumped up our order already. We usually order our flu shots early, like in March or so, and here at headquarters, we give about between 400 and 500. So this year we went on ahead and we've ordered 600 shots, expecting more people to receive them. We also address a special population, and we do it because we have here in the headquarters office, 15% of our population are 65 plus. And so what I do is I get that list and I email each person individually and offer it as an invitation, and I put voting buttons on it, and they just respond to the email telling me whether they would like a high-dose shot or not like a high-dose shot. And then I order those specifically for the people to make sure that they have their own reserve for them. And then they come in during our normal walk-in hours for to receive that shot. So we don't do those when we go out into the our locations. Next slide, please. So typically what we do is we set flu clinic hours, then we send out emails, we put it in the newsletters, we have video screens with all of the happenings in the building and events, and so we get it posted. we go out to conference rooms and we have a 5-story building that we're in, and we have large conference rooms, one on the east side and one on the west side. And so we go out to each floor, each side, over about a 2-week time period, and we stay there for maybe an hour or two, and that's where we give the bulk of our immunizations. In the plants, they are going to venture out to the control rooms to try to get to the population of the operations that can't leave their jobs because they're manning control boards, or that it's going to take too long for them to leave the facility, get up to the health services just to get a shot. So to take away that barrier with those employees, we bring it to them. We also offer it during surveillance visits, so when they're coming in for mandatory physicals, during just regular office visits. And we start usually mid-September, early October when we receive the immunizations, and we keep them available all the way through January, February, as long as we still have stock, because people change their minds midway through, or they've had a family member who's had the flu and they, decide to get the shot as a reaction to something. So we keep it available, and we don't have a cutoff date. So our participation is 100% voluntary. Last year was our first year to go 100% paperless, so we were very excited about that. Using the enterprise health system, it saved us probably at least a full workday per nurse, because we didn't have all of the paperwork to deal with after we were done with the immunization. So that was truly amazing for us. This year, we're going to attempt to do the consents ahead of time using the portal. We also have an administrative assistant that we set up ahead to deal with the people as they enter. And if they don't have the consent done, we've got some tablets that are programmed for the portal that they'll be able to access it there. And then when they get to the nurses are set up and they give the immunization and document at the same time. And it's a 1-to-1 ratio for them, since we have a smaller staff. And the other thing that we do that employees really look forward to, are we do little giveaways. It's nothing big, but I find that just the smallest giveaway, or just some trinket that they like. And so we tie these giveaways to flu season. So we may get a customized box of Kleenex with a little flu saying on it and the CITGO emblem. We give away hand sanitizers, encourage that. We'll give them stickers that says, "I've got my shot," and then they'll go around and show their coworkers that they got their sticker. We will do suckers, and we'll have sugar-free suckers available for people who don't want the sugar. So we have a few different things like that, and it just makes it more of a fun, inviting environment for them to come in, and they look forward to that. And that is it. Thank you.
Great. Thank you, Tiffany. Great presentation, and hilarious to hear that suckers work on adults as well as they do for kids. So I guess we never stop enjoying those. So our last panelist is Emily McComb, and Emily is the Director of Customer Success at Enterprise Health. And Emily and her team have been working with Samantha and Tiffany and several other of our clients to really modify our application in support of the 2020 flu immunization programs. And we're kind of, we're knee deep in that process right now and making those modifications. But Emily's going to give you a preview of some of the things that we're working on.
All right. Thank you so much. Yeah, we have worked pretty hard to put together a flu program that your employees can interact with from a computer, a desktop computer, or a laptop, or their cell phone. We know that for a lot of you, you're really looking for your employees to be able to do your consents online, and it's a lot easier sometimes to capture their attention on their cell phone rather than a computer, because they may not be sitting at a computer all day to see email notifications that come through. So we're excited this year that we can start doing more with SMS messages. So invitations to complete their consent or schedule their appointment, if you do your flu shots by appointment, can all be done on their cell phone through SMS, which I think is great news. As Samantha mentioned, you can also put up posters around the organization with QR codes that are programmed to take your employees straight to that employee portal when they scan that with their cell phone. Our marketing team has put this poster together, and we can send this out to you if you'd like, and we'll even put the QR code on there for you so that you can post those around break rooms and such to help get that participation driven up a bit. We can also target SMS and email notifications based on demographics that you find in the chart. So for this example here with Mr. Fred Anderson, you can see that he's employed by Better Corp. He's 37 years old and his job is in transport. So based on any number of factors that you see on the screen here, we can target communications to him. I think it's brilliant that Tiffany is doing this with some of her higher risk populations, and that's something that you can certainly do out of the system just based on the demographics that come through your HR feed. When you send out the notification to fill out the consent paperwork online, it's done so on the employee portal. So you don't have to exchange paper, you don't have to exchange pens. Previously, a lot of these consent forms were captured at the time of the event on a shared iPad. We still think a lot of customers are going to choose to go that route, but just being more and more conscious of wanting to not, all touch the same device, we think that, for a lot of our customers, they're going to rely more heavily on notifications to go out before the event so that people can fill that out on either, again, their personal cell phone or laptop. The consent form can also be used to collect acknowledgement of educational information as well. So let's say an employee chooses to maybe decline the vaccine, you can actually conditionally display some education here and ask them to acknowledge that before they go through and do the declination process, which I think is really helpful because we know there is a lot of information and misinformation out there right now about vaccines. So we're excited to be able to offer those as kind of conditionals on the consent forms. You can also ask a series of questions that may be traditionally collected on paper the day of the event. So you can ask them about allergy and medication history and medical history. And then based on the information that they share, you can actually provide notification that maybe they need to speak with a medical professional before they would reach out for that vaccine, or that they need to call you and discuss if that vaccine is a good idea for them based on some risk factors that they would be adding into their consent form here. When it's time to administer the vaccine, either at an event or by appointment, we really want to make sure that the folks doing the documentation, be it clinical or administrative staff, that they're working solely off of one screen. As Sam outlined with Wake Forest, they have a couple of administrative folks who are doing the documentation for the nurses who are actually doing the vaccine administration, so they can focus solely on that clinical interaction. And whoever those administrative folks are, we want to make sure that they're just working out of one screen and they're not needing to bounce around from place to place in the chart. So the screen that you're seeing here is the vaccine administration screen, and the only thing they need to change from patient to patient or employee to employee is just really the name. If the lot number or something like that changes, mid-event, they can update the lot number, but all of the information that you're seeing down here is sticky. So each time you submit the screen, this information stays, and all they have to do is put in the employee's information. We're actually looking to further reduce that data entry using 2D barcodes found on the vials themselves. The CDC has done a nice job of requiring certain information to be held in those barcodes. So that's something that we're looking to launch this year. So really all the person who's doing either the documentation or doing the vaccine administration would need to do is just run a barcode scanner over this. It'll work beautifully with just iPad cameras or tablet cameras. So really you shouldn't need any special hardware either, which is certainly very helpful. Sam did allude to the fact too that we can scan employee badges to pull in the name. So you don't even have to type that out either. Certainly that's dependent on some of that information being contained in your badge and the type of badge that you use, but that is certainly an option as well. So really our goal is to get this to a point where you're scanning a badge for a patient name and you're scanning a vial for the injection itself, and that's it. And no one is actually needing to type anything during the event. Once that information is all collected, we can show a flu compliance dashboard out on the supervisor or employer portal. Certainly this is more appropriate for those of you who require this, like in our healthcare customers. We wouldn't necessarily want to disclose this information to supervisors where the program is voluntary, but we can put this out here so that there is no surprise at the end of the flu season as far as who has completed that vaccine and who is compliant. And lastly, we know if you are spending the time and the resources to put on these big flu events, that someone in your leadership team is going to want to understand the outcome and the success of those events. So we're adding some additional dashboard reporting to give your leadership team visualization for the success of the program for that year. So they can understand what percentage of people were vaccinated at your organization, how many of the vaccines were done off-site, as long as we're collecting that information, which we actually are with quite a few of our customers, which is great. How many people maybe declined the vaccine and who had a qualified medical or religious waiver on file. So you can really give your leadership team a nice quick picture of the success of the program throughout the year, which we think is really helpful. So we're excited to launch this dashboard this year. And Jeff, with that, I'll turn it back over to you. I know you're monitoring the Q&A, and we'll open it up for questions.
Yeah, and thanks, Emily. That was great, too. And yeah, we do have certainly plenty of time here left for questions. We've already gotten several that I'll start throwing out here. But again, a reminder that you can pose questions using the chat feature in WebEx. So here's a question for Samantha. Given COVID-19, are you still going to allow walk-ins to your clinics, or are you going to require appointments?
I probably should have mentioned that too when I was explaining it. We actually don't vaccinate inside our clinic locations. We, on our main Winston campus, which houses the majority of our population, we actually vaccinate in pods in our cafeteria. We section out a large area. We have engineering set up partitions, and we vaccinate down there so that we can keep the line or reduce any lines and keep all that commotion out of our clinic so that we can maintain a normalcy up in the clinic setting.
Okay, great. Thank you. And I guess this is a question for everybody, and I think you guys have touched on some of this, but one of the questions is, can you talk a little bit more about what changes with your planned approach for 2020, based on COVID-19? What are some of the adjustments that you're planning to make? And Emily, you might talk about the fact that I know, like, for example, in the past, a lot of our clients have used iPads and had, you'd have an administrator kind of collecting information, and then you'd have people actually sign the iPad and give consent or, right there, which obviously we don't want to do in a COVID-19 environment.
Yeah, absolutely. It's been a pretty popular choice in the past to kind of work the line, so to speak, with an attendant who's, having people sign their forms with their finger on an iPad. We're certainly seeing a big push to the employee portal to fill those out electronically instead. And so for some of our customers who, maybe they have pretty significant network restrictions and don't let their employees traditionally onto that employee portal from a personal cell phone, are getting creative with us and figuring out ways that they can accommodate that securely and safely. So that's been great. And I know that's something a lot of organizations are leaning towards, putting that employee portal really at their employees' fingertips on their personal device, rather than requiring them to be in front of a computer, because for so many of, especially like the industrial customers that we work with, these employees are not sitting at a computer to be able to see that. So that's been a big trend, just getting creative with that security and privacy team to understand how we can safely give access to folks from their personal cell. But Sam and Tiffany, I'm interested to hear, logistically what you guys are thinking about changing for this year.
So this is Samantha. Logistically, we are obviously in the early stages of our planning, but I don't think that we'll have to make too many changes just on how we usually do it. Last year, we had almost no lines with the new process of having somebody documenting and then the vaccinators being able to just vaccinate and have people move on. And we also weren't requiring them to touch the iPads at that time either. So I am hesitant to say that we won't be changing much, but it looks like we won't need to.
Oh, that's awesome.
Are you guys going to do anything to kind of account for like the 6 foot social distancing and that kind of thing if people do line up?
Yeah, and that kind of helps us with the spaces that we use. We do have a little bit more leeway to allow for 6 feet in between. We'll probably mark the ground so that if we do start to have a line, we can make sure that individuals are spaced out. Our hospital has a mandatory mask initiative happening right now, so every single person has to be masked when inside the medical center. That'll also help those feel more comfortable while they are standing around or congregating to wait for their vaccine. And we do run the clinic at most of our locations Monday through Friday, so we will likely be ready to ask individuals to come back at a later time if the lines get to be too long.
And this is, we've got those same types of things in place for our building. We still haven't, we've brought just 100 people back to our building so far. We're doing a gradual return. So I'm hoping that we can have most people back in the building come September, October. Our company's been very slow in return. So if not, we'll probably do it outside and let people drive through and complete it that way. Everybody's working from home really successfully, and with the portal and with the access, we'll use that and still offer it to them. So we'll just have to see what the situation is at that time as to how we're going to handle it.
Yeah, no, that's an interesting observation because obviously, depending on what happens with COVID, if we see more spikes, and you might have people who come back to work and then all of a sudden are again working from home, and yeah, how do you handle still taking care of flu shots and that? Yeah, the outdoor approach is an interesting one. Emily, here's one probably for you. This is from somebody in a health system setting, and they're asking from a security standpoint, can nurses at the locations be set up to only see the flu vaccination workflow and not the rest of the employee's record?
Yeah, that's an important question. Let me go back here. What you don't see in this screenshot, Cecilia, is that this menu, there's a little menu icon up here, it's collapsed, and they're in this role, they're locked only to this page, to this injection program page. So that's really important. We do have a limited access security role for flu administrators because we know sometimes, they might just be nurses, especially in a health system, nurses who are volunteering for the event from a completely different department. They don't work in employee health, and they shouldn't have access to the rest of the record. And there's a little, again, it's not shown in the screenshot, but there's like a little pop-up here in the corner that can give you a red flag if someone has a contraindication, be it a condition that's on their chart or previous bad reaction to flu. They would see those types of pop-ups because it's clinically relevant to the flu administration, but they don't see anything else, and they can't get into the employee's chart from here. That's a great question. Thank you.
Question for Tiffany and Samantha, and that is, have you already made plans to purchase needles and alcohol wipes, because both seem to be in short supply? So not just kind of getting more vaccine, as Tiffany you mentioned, but the associated supplies.
Hey, this is Tiffany. When COVID started, I made a huge order for all of the needed supplies then, including needles, alcohol swabs, and Band-Aids, anticipating that everything would be in shortage. So we did that in February, early March.
And this is Samantha. We also already have all of our supplies ordered. We actually talked to our flu vaccine rep as well, just to make sure that we were going to have those supplies in, and we have that order placed too.
Another question that just came in is, can you guys expand on, and this is probably especially for you, Samantha, can you expand on exemptions and those that decline the vaccine? And maybe with that too, you guys might talk a little bit about, sort of what you're seeing with anti-vaxxers and how do you typically handle that?
Yeah, so I can comment on that. We have 2 routes an employee can be exempt from obtaining the flu vaccine. One is a medical exemption, so it has to be a letter from a physician or other provider stating that there is a medical contradiction to receiving the flu vaccine. I will note that we no longer accept egg allergies as a reason to not be vaccinated. The CDC stopped recognizing that a few years ago, so we in turn also don't accept it any longer. A religious exemption, an employee can submit a religious exemption just stating that it's against their religion to be vaccinated. We honor all of those requests. From an HR standpoint, that's kind of the route they decided to go with. I will say that last year we had less than 200 medical and religious exemptions total, so it's a really small population for us.
Can we just help you brag on yourself here first, Samantha? What's your compliance rating within your organization?
As of right now, we were at 100%. We were at 99.3 on November 1st.
Wow.
That's outstanding.
I was going to say, Tiffany's had some really fun interactions with some of her team who've been concerned about receiving the vaccines. I wonder if you wouldn't talk to us a little bit about that, because you have a very different perspective, Tiffany, since your program's voluntary, but I know that's something you've fielded in the past.
Yeah, we've had employees have very extensive conversations. We'll sit down with them and pull out the ingredients and let them read the ingredients. And so we don't handle those types of situations like in our conference rooms or when we're out in the locations. We'll ask them to schedule a time and sit down with myself or one of the nurses to go through their concerns. Let them leave, let them think about it. So we may have somebody visit 2 or 3 times because they're so distraught over making a decision whether or not to get the flu shot. Last year, I've had an employee who had some negative experiences with vaccinations with his children, and he, wrote me some very, very detailed emails, and he was upset that I was promoting flu shots. And so he and I went back and forth, and we talked about it and tried to, get on even ground with it. And so it's finding a balance for us, and and make sure that he also understood that people had the right to receive the vaccines just like he had the right to not receive the vaccine. And it's just handling the different personalities.
Yeah, that's great.
Gotcha. And Samantha, this is just a clarification question for you. When you say compliance, that means both those that were vaccinated and includes the people who can show an acceptable exemption, right? That all adds up to your 100%?
That's correct.
Okay, great. And Emily, this is one that I don't know if we've encountered or not, but the question is, can we account for those companies that vaccinate employees' family members as well?
Oh, yeah. Yeah, absolutely. You can track dependents in the system. We do have some customers who offer several services actually to dependents who are either, just maybe only on the company-sponsored health plan. And so we can do some checking against those records to be sure that they're, qualified to use the clinic services. But yeah, absolutely. We can track those dependents, and we can either treat those as just standalone medical records, or we can actually link them to the employee's records so you can kind of group the family information together as well. So yeah, that's actually something we have done in the past and can do so pretty easily.
Okay, great. And here's one that probably both Emily and Samantha, you may be able to comment on this from in terms of what Wake Forest does on an outsourced health basis. But the question is, any recommendations for an occupational health provider that goes to 300 or 400 client companies to do flu clinics, where each company has different setups and access to electronic devices and those sorts of things?
I can say that we found. Sorry, go ahead, Tiffany.
Go ahead. No, go ahead. Go ahead.
I was going to say, we found that taking the iPads, we actually go to a couple different locations when we screen. Taking the iPads has been huge. As long as they have Wi-Fi available, you can pretty much access any of the same systems and do it the same way. Okay,
great. And Emily, were you going to say anything there? Or?
Nope. I would just be piggybacking on what Samantha said, so that's great.
Okay, great. Yeah, Samantha, you talked about the fact that you kind of separate out. You have a couple of people who actually, do kind of the check-in and the paperwork electronically on an iPad, and then, different people who administer the flu shot. And I know a lot of our clients in the past, at least, they've had a single person kind of do everything. Can you talk a little bit about how your employees have reacted to that approach? Have there been any issues, and then what are the benefits that you see from doing it that way?
Yeah, absolutely. So I will say that we started doing that about 2 years ago. The benefits have been, it has greatly reduced our lines. We, like I said, last year didn't have any lines while people were getting vaccinated. It helps to be able to streamline that through the administrative process in the beginning, and then just go and get your vaccine right in front of you in one of the setup pods. The feedback we receive from our staff has also, our employees of the medical center has also improved. They like that they have someone they can talk to if they're having any problems filling out their forms or if they have any questions. And then when it comes time to get the vaccine, they can just go get their vaccine and then leave.
Gotcha. Great. There are a couple of technical questions that I'll just respond to here. One about, can the information from the application download into other applications? And the answer is yes, absolutely. The enterprise health solution is extremely interoperable, and we've set it up to be able to interface with and integrate with other solutions and applications. Another question about how does information for demographics and job locations and those sorts of things get into the application, and is that done manually? In almost every case, our clients, we set up an HR interface, so we're interfacing with Workday or SAP or PeopleSoft or whatever you might have, and then we're getting that data in a regular feed, so that there's no need to enter that data. It can be manually entered on a case-by-case basis if you need to, but 99.9% of the time that's all automated, so that there's not a lot of effort for the people who are doing things. Yeah, another question was, can we connect with Epic? And again, back to the earlier question or response. We routinely interface with other applications, and most of the health systems that we work with, are using either Epic or Cerner. So we routinely interface with both of those organizations.
Just to piggyback on that too, actually, something pretty cool that we did with Samantha's team at Wake Forest was to take the information found in Epic and, with informed consent by the employee, actually transfer that to us. So if an employee, just happens to get their flu shot because they're at their provider for their annual checkup, whatever it might be, we're actually getting that data out of Epic sent to us on a daily basis. So Sam's EHS team doesn't have to go chase that information down from the employee. We know right away if they're compliant because they've just done that at their primary care provider. We're actually getting that in a feed every day. The employee knows that it's happening and they have to provide consent to do so, but it really does help to reduce kind of the chasing around that their team had to do. So that was something neat that we put in place with Samantha last year.
Another question is, whether you have used temporary or contract staff in the past to kind of help ease the burden. And I know I can say that a good percentage of our clients, especially in the health system side of things, will add temporary folks to the team for a month or two in the fall. So it's not at all uncommon for our clients to say, hey, we need to add 30, 50, 100 additional users. And those might be other nurses. Sometimes they're medical students. Sometimes they're contract staff. And as we talked about earlier, we set up a separate security role for those folks, so that when they log in, the only thing that they can access and do is with that immunization module. So they're not able to navigate the rest of the solution and see other people's medical records. All right, and let's see if there are any other questions. I think that covers just about everything that we've been asked thus far. With that, I again want to thank everybody. This has been a really good, robust discussion and exchange of ideas. I want to thank our panelists, Samantha Lodish from Wake Forest Baptist Health, Tiffany Bould from CITGO, and Emily from Enterprise Health. I know all of you are incredibly busy managing COVID response and getting ready for flu season, so we really appreciate your willingness to prepare and present and answer questions and share what you're doing at your organizations. Also want to thank the folks at the Institute for Health and Productivity Management who helped us promote today's webinar. And thank you to all of you who attended today's session during what we know is a very busy time. As I said, we'll send out a link to access a recording of the webinar early next week. And then we'll be sending out information on our next webinar that's going to be coming up on June 24th. So again, thank you very much, and just reach out to us if you have any additional questions. And that concludes today's session. Thanks, everyone.
Thanks, Jeff.